How are they going to know me if they don't listen and they don't know what I'm going through? I'm not a carbon copy of the patient that was just there before me or the patient that's going to come in after me. I'm a unique human being, and I think that they should listen to their patient because they know best when they're talking about their body and their health.
Hello, everyone. Welcome and thank you for tuning in to episode number 1 of the Green Table Talk podcast, where we explore and decode the clinical wonders of cannabis. I'm Dr. Benjamin Kaplan, a board-certified family physician supporting medical cannabis patient care. I've supervised the clinical care of nearly 285,000 patients with cannabinoid-based therapies, and I've published in leading medical journals, including the New England Journal of Medicine. I also curate the world's largest library of published cannabis literature, which is shared free of cost at cedclinic.com. And my new book, the Doctor-Approved Cannabis Handbook, is available on bookstore shelves across North America and from wherever books are sold online. The history of cannabis is long and colorful. Its many uses originated in Central Asia or Western China and has been used for its healing properties for millennia. Therapeutic indications of cannabis are mentioned in the texts of the Indian Hindus, Assyrians, Greeks, and Romans. As far back as 2800 BC, cannabis was used to heal a vast array of different health conditions, including arthritis, depression, menstrual issues, inflammation, pain, lack of appetite, asthma, and the list goes on. My passion as a physician is interacting with my patients, offering guidance, learning about their lives, and hearing how and why they decided to seek out cannabis as an alternative to the usual way, to generally prescribed pharmaceutical treatments. There's much we are still learning about the benefits of consuming this plant, but boy, is there a ton of research studies already done and more underway, and lessons we can pull from experienced individuals today. One such patient is a 69-year-old breast cancer survivor named Betty. On top of her cancer diagnosis, recently fell and broke her kneecap in several places. She didn't want to take opiates for many good reasons, so she used cannabis capsules to ease her pain. Her recovery was going fine until she got sick with what she thought was a stomach bug. Her doctor advised her to go to the emergency room right away. There, she was diagnosed with colitis. They admitted her for an overnight stay so they could administer fast-acting antibiotics for her infection, and tried to help her control this new, unexpected disease.
So they just kept me overnight. That evening, I was released to come home and on antibiotics and very bad pain. I don't like taking drugs, pharmaceutical drugs, and I didn't know what to do. And so my friend said, get a vape. So every time I'd feel the pain, I'd vape. And then I really didn't want to keep doing that because of your lungs. So I stumbled on the Seltzers with the THC. So I started drinking them to ease the pain, and it made my stomach feel great. Also, it gave a little bit of an increase in an appetite because I was eating very bland food with the colitis.
For Betty, seltzers were working and she was feeling fine. But her doctor called her and told her she has to have a colonoscopy.
And I said, can't I just do the colon box? And he said, no, because you have colitis, we have to really go in and see how bad it is, what it's doing, and treat it. And I said, okay. I did that whole prep, thinking it was going to rip my stomach apart. And then went in for my colonoscopy. And when I came out of it and was in recovery, the nurse came in and she said, okay, Betty, I have your paperwork here. And I thought to myself, oh, geez, okay, I'll see you in 3 months. And she said, you're good for 10 years. And I said, what? I said, what about the colitis? They said I had the colitis. What about the colitis? And she said, you don't have colitis. There's not any sign of it. And I thought, I said to myself, I don't care what anybody says. I don't care what any medical doctor will try to tell me. I know what took that colitis away. And I swear it was those Seltzers because colitis doesn't go away. You always have it. I haven't had any flare up at all. No one can tell me different.
To me, it's always good news when a patient of mine finds a cannabis product and solution that works for them. Seltzers are a fast-acting cannabis-infused drink. Most have about 5 milligrams of THC, although some have even higher doses. Seltzers offer a healthier alternative to other forms of cannabis consumption because they allow for precise dosing. They have fewer calories, and they provide for longer-lasting effects for most people. I needed to know more about what Betty's mindset was, and so I asked her if she was skeptical at first.
No, no, because I always think, what did the medicine men do? The Indians. They were using herbs, and I'm a real believer in that. So I think something that's naturally grown is much better for you. There's no side effects. If you have a cannabis salsa, you don't have a hangover as if you were drinking liquor. I don't even touch liquor anymore. I might have had a glass of wine here and there, but now I just have my salsas, and I wish they would put them in nightclubs and bars and restaurants. Really, that's my feeling. I just think it's a purer way to go instead of drugs. And of course, I was shocked that my colitis was gone because I figured, okay, this I'm going to have this till I die, and I got to watch what I eat, and I can't eat these, and I can't eat that. And she said, you can eat anything you want: strawberries, tomatoes, anything. I still think that it was the Celsius.
The seltzers seemed to have a positive effect on Betty's stomach issues. I was really curious. How much is she drinking? How often is she using it?
It varies. Like I'm having one right now, and I haven't had any for a couple of days. I'll have one, maybe two when I'm home sometimes, or just one. But when I go out, if I'm going to people's houses, or like Christmas Eve, I went next door to my neighbor's house and I took a little soft cooler and I packed 4 of them in there and brought them. And over the course of the night, I drank 4. And that was with eating. I was eating and everything. And after my fourth one, I said, yeah, I'm going home. It was time to go home. But I wasn't falling down. I was just real mellow and wanted to come home and put my pajamas on and go to bed with my dog and cat. But yeah, there'll be times that I don't drink any for a week. And then a Friday night will come and I'll have 1 or 2, depending on what I'm doing. But anytime I go to my friend's house, I'll always pack 3 to 4 of them because I never know if they want one. So I always bring extra. And what I don't drink when I do go over a friend's house, I leave them in the refrigerator. And I say, help so.
So many conventional doctors and caregivers are underinformed or flat out misinformed about cannabis treatments, and sometimes have a hard time even listening to patients or believing their stories. Betty's doctors were no different.
About the colitis being gone,
Yeah.
blank face. They didn't say, yeah, you're right. Or, oh, Betty, no. It was just almost like, yeah, okay. That's your opinion. And I tell everybody how good it is. I don't know why more doctors don't want to go that way. When I was, after the breast cancer, I was thinking about going to a cannabis doctor, and I mentioned it to my oncologist. She was the only one that said, Betty, yeah, sure. We just don't have them here. But there's plenty of doctors out there that are cannabis doctors. And she didn't try to say, no, you shouldn't do that. You should say, she was good about it. But I will be seeing a new primary, which I'm wondering how she's going to be because my primary actually left the business. And I'll be seeing a new doctor. And I'm nervous and excited and wondering how she's going to feel about me and what my beliefs are with the cannabis. How are they going to know me if they don't listen and they don't know what I'm going through? I'm not a carbon copy of the patient that was just there before me. or the patient that's going to come in after me. I'm a unique human being, and I think that they should listen to their patient because they know best when they're talking about their body and their health.
Another common issue is the potential fallout from telling your friends and family that you're trying out a new cannabis-based therapy for some of your medical issues. The reactions can be mixed, anything from expressing their doubts or flat-out objections to offering, hopefully, wholehearted support.
I would say 95% when I tell them, they're like, "Oh my God, Betty, that's amazing. That's wonderful." They're not like, "Oh, Betty, come on." I only had one person say, "Okay, if that's what you believe." And I'm like, "Okay, I shut it down. I don't have to go any further." But basically, I'd say 95% of my friends agree with me and they're happy for me and they believe me.
Betty is a happy, willing advocate now for medical cannabis. What would she say to someone new to cannabis about the products that she's experienced or her experience in general? What would she tell them?
Give it a try. I have a friend right now that's going through chemo and told them about the Seltzers. And it was at Christmas time. And he was going to his family's. So he stopped and he picked up Seltzers. And he said, Christmas was a lot more enjoyable because of the Seltzers. He felt better. He wasn't in pain. And he's going through some heavy duty treatment. When I tell people, it's try it. I had another guy that I just told he's got arthritis. And I told him, go get it. Try it. You've tried everything. He's drinking them. And he'll sometimes get flour for pain too, but which I believe in. I believe in it all. I really do. And I think that anybody that's having any pain or health issues that want to try a different way should try it. Give it a shot.
Have you ever had too much, Betty?
Of the salsas? No. Like I said, 4 would be my limit, and that's with me eating there for hours and hours. So it would be like having 4 beers. No, I've never had too much. The only time I can say that it affected me more is when I had a salsa and then decided to hit my vape. My vape is Happy Valley, 1-to-1. And if I have a salsa and do that, then I'm giggly. I'm really giggly. Oh boy, yeah, I wouldn't drive. Let's put it that way.
Doesn't sound like the end of the world, though.
No, it's not. You're just happy and giggly.
Betty's attitude is nothing short of incredible, and I realized I had missed or skipped over an important piece of her story. I wanted to learn more about her, who she is, and what brought us together.
I'm 69, and I took care of my sister for 5.5 years through cancer treatment. I begged her to go on medical marijuana just for the pain. She said, oh, I said, I was the one that administered the morphine to her at the end. She died in my home, which was her wish. So I went through all that, and then the mourning period, and then I got the breast cancer diagnosis. And I said, oh boy, here we go. So I went through radiation. 4 weeks of radiation every day, Monday through Friday. Then I, had broken my ankles, broken my wrists. And when I broke my kneecap, that's when I said, I don't want to take these oxycodons. So I started taking the capsules for THC to take away the pain. And I go to the gym. I'm active at the gym. I'm taking a trip to Bosnia in April, which I'm very excited about. I'm living my best life, actually. I really am living my best life. I'm healthy. I'm happy. What more could I ask for?
How did you find me, Betty?
I found you through a woman that after my sister passed away and everything, I said I wanted to do something. So I went and volunteered at this little thrift store. It's called Seniors Who Care. And the woman there, I volunteered, but she was getting paid. And her name is Susie. And we started conversing. We're very good friends. We're like sisters now. And her daughter goes to you. I said to her, I wanted to find a cannabis doctor. I wanted to go that route. And she said, I got the doctor for you. My daughter goes to him. And that's how I got Dr. Kaplan. The greatest day of my life.
Thank you, Betty. That's very sweet. Betty's inspirational story is not unlike thousands of others who have sought relief from cannabis-based therapies. But what works for her may not work for you. Every person is different. Or as Betty puts it, quote, I'm not a carbon copy of the patient that was just there before me, or the patient that's going to come in there after me. So it's important to listen and seek guidance from your doctor and learn about the products that could offer you the most relief, based on what sets you apart from the rest. The beauty of cannabis is in its versatility. One set of products may bring relief in one situation, while other treatments are more appropriate for others. Understanding which type of ailments match with which formulations of cannabis comes down to a blend of research, personal exploration, clinical expertise, and then bringing it home with medical guidance. And that's what we're here to explore on each episode of the Green Table Talk podcast. Thanks for listening to the Green Table Talk podcast. If you have questions, you can email me, info@cedclinic.com. Thanks for listening.